Oxygen therapy. Oxygen therapy. Oxygen is a colorless, odorless, tasteless gas that is essential for the body to function properly to survive. Oxygen therapy is the administration of oxygen at a concentration of pressure greater than that found in the environmental atmosphere. The air that we breathe contains approximately 21% oxygen. Oxygen therapy is a key treatment in respiratory care. Purpose: the body is constantly taking in oxygen and releasing carbon dioxide. If this process is inadequate, oxygen levels in the blood decrease, and the patient may need supplemental oxygen. The purpose is to increase oxygen saturation in tissues where the saturation levels are too low due to illness or injury. Indications: acute respiratory failure, acute myocardial infarction, cardiac failure, shock, hypermetabolic state induced by trauma, burns, or sepsis, anemia, cyanide poisoning during CPR, during anesthesia for surgery. Oxygen, a prescribed drug, must be written legibly by the doctor. Prescription should be dated by the doctor. Doctor must indicate duration of oxygen therapy. The oxygen percent concentration must be prescribed. The flow rate must be prescribed. Oxygen cylinder. Using oxygen cylinders, the oxygen cylinder is delivered with a protective cap to prevent accidental force against the cylinder outlet. To release oxygen safely and at a desirable rate, a, regulator is used. A reduction gauge that shows the amount of oxygen in the tank. A flow meter that regulates the control of oxygens in liters per minute. Oxygen is moistened by passing it through a humidifier to prevent the mucous membranes of the respiratory tree from becoming dry. Wall outlet oxygen. Methods of oxygen administration. Nasal cannula. It is disposable plastic device with two protruding prongs for insertion into the nostrils, connected to an oxygen source. Used for low-medium concentrations of oxygen, 24 to 44%. Nasal cannula. Nasal cannula. Advantages: client able to talk and eat with oxygen in place. Easily used in home setting. Safe and simple, easy tolerated, delivers low concentration. Disadvantages: unable to use with nasal obstruction, drying to mucous membrane so flow greater than 4 liters per minute. Needs to be humidified, can dislodge from nares easily. Causes skin irritation or breakdown over ears or at nares. Not good for mouth breathers. Patient's breathing pattern affects exact. Nursing interventions. Be alert for skin breakdown over the ears and in the nostrils from too tight an application. Observe for mucosal dryness. Check frequently that both prongs are in client's ears.